In this video, we will address commonly asked questions and myths about peripheral neuropathy, suggest some ways to manage it, and provide some resources for you to learn more. Peripheral neuropathy is a common side effect of blood cancer and its treatment. It can appear during or after treatment, so early detection and intervention is recommended. Many people living with blood cancer find this has an impact on their everyday function and lifestyle. It is important to report any physical and emotional changes you notice to your treatment team. In particular, pins and needles, numbness, change in bladder and bowel function, or low mood, as they may adjust your treatment to reduce these symptoms. The central nervous system is a control centre for everything we do. Peripheral nerves are found in our face, arms, legs and chest. Messages, or electrical impulses, go from the central nervous system to the peripheral nerves. These nerves control the movement of muscles and sensations such as touch, pressure and temperature. If there is damage to our nerves, sensation, or the way we move is affected. In blood cancer, this is called peripheral neuropathy. It's impossible to know who will get peripheral neuropathy. The risk of damage to your peripheral nerves is greater with some chemo, targeted cancer drugs, and if you've had previous treatment. Some health conditions like diabetes, shingles, or excess alcohol and illicit drug use can add to the overall risk. Symptoms are individual and vary from person to person. It most commonly affects the hands and feet, though is not restricted to them. Symptoms range in severity from mild to severe, and you may notice pain or discomfort, sensations such as tingling, burning, or pins and needles, an increase or decrease in normal sensation, altered ability to sense temperature, muscle weakness or heaviness, not knowing where your limbs are in space, tripping or unsteadiness, difficulty doing everyday tasks such as opening jars, doing up buttons, holding things like pens, keys and cutlery. Changes to eyesight or dizziness, changing position, bladder and bowel function. Symptoms may resolve by themselves or they may be permanent. Many people recover within months after stopping treatment. For others, nerve recovery can be slow and depends upon how severe the damage is, any pre-existing conditions and your own individual response. Currently, there are no proven effective, long-lasting treatments available. Can be managed with medications, exercise and complementary therapies. Discuss your options with your treatment team. You can manage symptoms to reduce the impact on your quality of life.
Peripheral neuropathy is a common side effect. It began in my hands and feet, slowly progressed over 15 years up to my elbows and beyond my knees, and also I thought my head. It can feel like walking on rocks or cauliflower. It's not painful, it's just uncomfortable and at first disconcerting. I changed to a different drug which reduced the neuropathy to just my feet and hands. I'd like to think there's been some regeneration of the nerves. What's the biggest challenge? Peripheral neuropathy has meant a loss of discriminatory sensitivity in feet and fingers. Doing up buttons requires concentration. I found that I can manage the effects of peripheral neuropathy by firstly being careful and watching where my feet are, especially walking down steps and stairs. Very aware of being careful, placing my hands near woodworking tools such as power saws. I found wearing socks in bed means my sleep is not disturbed by feeling the sheets on the bed. They've also reduced my restless leg twitching while I try to sleep. I talked to a podiatrist. On his advice, I have bought good shoes which provide full support for my feet.
Prevent cuts and burns, for example, by using rubber gloves and pot holders in the kitchen, taking care with the temperature of hot water bottles and heat packs, and testing hot water with your elbow. Do regular skin checks to look for rubbing, blisters, cuts or burns, and keep any abrasions covered and check for signs of infection regularly. See a podiatrist to manage foot care. For sensitive feet, use silk or bamboo sheets and use a frame to keep bed linen off your feet. Create a safe environment and have an occupational therapist assess your home for hazards. Wear supportive and correctly fitted footwear. See a physiotherapist for advice on exercise, strengthening and balance, or prescription of mobility aids. Slowly change positions, lying to sitting and sitting to standing. Sit down to wash your feet and put on shoes and socks. If experiencing dizziness, seek medical advice to assess for any reversible cause and review of your medications. Practice relaxation and mindfulness. Try a walk in nature, yoga, meditation. Get regular good quality sleep. Remember to nourish your body with nutritious food, drink enough water, and keep moving. Before using complementary medicines, discuss drug compatibility with your treatment team. Check with your doctor that you have enough sensation, speed, and muscle strength to drive safely. General practitioner management plans and mental health treatment plans can be accessed via your local doctor for services such as physiotherapy, podiatry, occupational therapy, and psychology for ongoing specialised support.